All of our tongue tie consults, birth through adults, really involve three components. And the components are symptoms, functionality, and then anatomy assessment. So we're asking them, what kind of impact is this having on your life? What are you seeing symptom-wise? We are doing an age-appropriate movement assessment. With all of these assessments, we're also looking at how the bony structure is also developing.
I love the Function First model because interdisciplinary care is the most effective type of care.
The Function First approach became part of my process about 18 months after starting to do this. And that's because when I originally started learning about tongue ties, I didn't really understand how important the muscle movement, muscle memory, and whole body connection was to the outcomes of the procedure and the patients actually functioning well. When I initially started, I would say I took a very sort of surgical medical approach to it. You see a tie, you release the tie, and then the tongue's supposed to work. That worked well for a small population, but it's definitely not a predictable way to treat tongue ties or any tethered oral tissues. So when I kind of took a step back and looked at, how to make this more whole body and more functional, I really started to see the value of the fact that the procedure is just one small piece of successfully getting the tongue to work correctly. So really the Function First approach is a whole body and whole family approach to tethered oral tissues. The functional providers are our therapy providers. They are most commonly for infants, IBCLCs or speech-language pathologists for oral motor feeding help. For body work, most commonly chiropractors, physical therapists, or osteopaths. Also some craniosacral therapists. For the older population, speech-language pathology again is applicable, myofunctional therapy, and a similar set of bodywork providers. Once we've determined a procedure is needed, we recommend completing the pre-therapy work with the functional providers. And then we do all of our procedures with a light scalpel carbon dioxide laser. A functional frenuloplasty allows us to relieve the tissue that's causing the restriction without relieving too much or not enough. Before and after a functional frenuloplasty procedure or even an infant frenectomy, there are very specific stretches and exercises that need to be done to aid in healing.
From my experience, what I've seen clinically, the overall success rate of the actual release itself is tenfold when we approach it with a functional frenuloplasty technique.
For infants, we tend to see feeding improvement within the first week. So the first few days can be a little bit up and down, but usually once we see them back for their first post-op appointment, that's usually around a week. Things that we most commonly see are better quality of latch, less gassiness. Everyone notices more tongue mobility, but sometimes it's not as coordinated as it needs to be yet. When we're talking about toddlers, sometimes we see an increase in vocalization within the first few days. For the adults, the most immediate thing we see is tension release. When we're going to entertain doing a tongue tie release procedure, we not only have to look at the tongue movement and functionally what's going on, but we also have to look at the structure that the tongue needs to live in. Sometimes, it's more than just the therapy component. Sometimes we have to look at the structural components first and address those things before moving on to a tongue tie release procedure.